Well, thank you. I know that you all are all busy people, and so thank you for taking some time to do this. My name is Erika. I am our pre- and postnatal / pelvic floor specialist, which is something that I fell into accidentally. Like, I did not think I was going to grow up and be a pelvic floor specialist, but life happens and you realize what's important, and so here we are. So we are just going to kind of talk about all things core and pelvic floor. So this seminar is appropriate for anyone who's ever had a baby. I used to call it pre- and postnatal seminar, but then people, like everybody that was in here was like 28, 32, they just had a baby, but this is truly for everyone because this information is not getting out to people after they have babies. So thanks so much for coming. Please feel free to interrupt me at any time. So again, everybody is postnatal. Once you've had a baby, you are postnatal. There are some structural changes that happen during pregnancy that are permanent. There are some structural changes that are permanent until you have rehabbed. So if you have not done any sort of rehab, your body is still behaving like a postnatal body. Does that make sense? So I want to be really clear about something. My priorities as a postnatal fitness specialist, number one is overall wellness. So if you have a little tiny person at home, are you sleeping? Are you eating? Are you feeling calm and connected to your baby? Are you taking general good care of yourself? Mental health is stable. That is higher priority than what is typically marketed as postnatal fitness. As soon as you have a baby, get your baby back. Gotta get skinny. For me, that is last priority. So what we look at is number one, your wellness. Number two, functionality and strength. Is pelvic floor doing what it's supposed to do? Is core doing what it's supposed to do? And there's a lot of confusion about that, people think that, oh, well, if I still have weight to lose, then my core is dysfunctional. And that's not always true. You can have a very strong core and more body fat than you would prefer, or you could have body fat and an excellent core. Those two things are not connected. And my part of the conversation is function first. I want you feeling good. I want you feeling strong. I want your symptoms decreasing before we ever have a fat loss conversation. Okay? So number three is fitness. And I want to point something out. Wellness is different than fitness. Okay? Fitness is cardiovascular, stamina, can you run a mile, can you lift this, can you do all the fitness tricks that people are doing on Instagram? But that is different than overall wellness, okay? And I never want your fitness to interfere with your wellness. Does that make sense? So I get a lot of young moms who they've had the baby and they're doing the thing and they're back to boot camp, but we're not well yet. And so fitness, wellness, different conversation, wellness, higher priority. Last conversation is if you want to have some fat loss, that's your prerogative, but just ask yourself, why? Like, do I really need to look like I didn't have a baby? Because I did, in fact, have a baby. So why do we need to destroy the evidence of that? That's okay, in my opinion. So just want to put that out there, that this is not a fat loss seminar. This is a core and pelvic floor function seminar. And my priority for you is that you feel good and you feel strong, not necessarily that you look in this very narrow definition of what society says mom should look like, okay? So, core and pelvic floor dysfunction are an equal opportunity experience. So the reason I put this picture up there is I am here because I had pretty significant pelvic floor dysfunction, okay? But I was a very, very fit athletic person. I've competed on multiple continents. I've done all kinds of things. There's nothing in my background that I did that would have indicated that I would have pelvic floor dysfunction. Okay, so a lot of times when I meet with women, they're saying, they're like, oh, I'm so like I have issues with my pelvic floor, as if they need to be ashamed. Like maybe there's something I did. I wasn't fit enough in my pregnancy, or I didn't do enough, or I didn't know enough, and therefore I feel ashamed.
Class was easy.
Got it. So I want to say that it does not matter. You can be extremely fit. You can have not quite the fitness that you're looking for, but pelvic floor dysfunction can kind of hit anybody, just depending on your own personal biomechanics and kind of how things shift when you are pregnant. So you did not do anything wrong if your core and pelvic floor are not functioning. No need to be ashamed. You do not need to apologize for not doing your Kegels. We'll talk about Kegels in a second. It's very, very common, and you are not alone. Questions on that?
You?
What's that? That's me.
Okay.
I know, different era of my life. Now I drive a minivan, and I'm like, what? Who is this? Okay, so again, I did not know I had pelvic floor dysfunction. I was racing, very, very fit, but I was having hip pain. I was having back pain. My IT bands hurt. Everything hurt, but I did not know that the root cause of that was pelvic floor dysfunction. I was also leaking significantly. peeing my pants at every race. I talk about it openly because I want to remove the stigma. Like, this happens and it's happening to all of us. We're just not talking about it. So a lot of times people tell me, they're like, I have an issue when I sneeze. Like, I know you and everyone else I've talked to today. Okay, so this is literally almost everyone, whether you are fit, whether you are just getting back to the gym, nearly everyone is having some issue with this, and it's okay for us to talk about it. We don't have to be ashamed. So the other thing that happens is moms, aunts, cousins, everyone's like, oh, you've had a baby girl, welcome to your life now. And I'm just here to give you the message that it does not have to be that way. You do not have to live with this. It can get better. So don't accept that social stereotype that that's just what moms do. Okay, it can get better. The peeing issue, the pelvic pain, that is common, but not normal, and it can improve. So another thing that people apologize to me for is not doing their Kegels. Okay, they'll be like, I'm sorry. I mean, I know I'm supposed to do my Kegels, but I just haven't. We'll talk about Kegels, okay? I don't actually want most people to do a lot of Kegels, and certainly nothing you need to apologize for. So pelvic floor, we'll look at pictures in a minute, but what a lot of pelvic floor function boils down to is that something, somebody, some muscle group has to do the work, okay? Most of the people in this room are moms, so I think you'll understand what I mean by this. When everybody else is not carrying their weight, somebody else has to pick up the slack, right? Mom, we want a puppy, we promise we'll do it, right? Mom, we want to do all the sports, I promise I'll get a ride, right? And what happens when those things don't do their jobs? Mom does it. Does this sound familiar to everybody? Okay? So your body kind of works the same way. Your body needs to be stable. So if you step off a curb, you need to be able to catch yourself on one leg, right? If you slip on the ice, your core needs to be strong enough that your pelvis is stable. So if your glutes are not strong enough, your hips are kind of weak, the core is not functioning correctly, somebody's like, uh-oh, we need stability. Pelvic floor is like, I'll do it, okay? I'll get it. And now we have this super tight, over-functional pelvic floor, okay? And now you sneeze and that pelvic floor is not helping you, okay? Sometimes it happens the opposite way. The pelvic floor does everything. Pelvic floor is like, or no, I already said that way. Sometimes the pelvic floor is not helping at all. It kind of got loosened, maybe had a little tear during pregnancy, and so everything else overfunctions. Some of you have told me that your hips hurt, your back hurts, everything kind of feels tight. Sometimes there's a diastasis, and so since those inner muscles aren't doing the job, the outer muscles are like, ah! And they're just tight, tight, tight all the time, and you go to stretch and everything just kind of hurts. Oftentimes that's because either the pelvic floor or the surrounding muscles is doing too much of the work. Does that conceptually make sense to you? So we'll come back to that in a second. But I would like every one of you to go see a pelvic floor physiotherapist. What is really crazy to me is that in a lot of European countries, you have a baby and then you get a pelvic floor physio. This is logical. This makes sense. In America, you carry a baby, maybe you had a C-section, maybe you had an emergency C-section, and then you go to your 6-week checkup, and they pat you on the back and give you some birth control and say, good luck, get your body back. This doesn't make any sense. Where when people have a frozen shoulder, or people have a torn hamstring, or people have whatever, they go to physical therapy. But yet women's body go through this super changing, huge thing, and we get a pat on the back and a good luck and some birth control pills. So this is not okay. I don't know why OBs do not recommend this consistently. A lot of times OBs will tell you, oh, you just need to have surgery. You have a prolapse, you need to have surgery. You have diastasis, you need to have surgery. Where we don't tell people who tore their ACL that. We're like, let's try the rehab and see what happens, right? So I would like everybody to go see a pelvic floor physiotherapist. I have several in the area that I work with. Some of them take insurance, some of them don't. Some of them are harder to get into than others, but when I email you this presentation, I'll give you a list of local people that you can go see. So in terms of what to expect when you get there, sometimes it's just an external exam. They'll look and see kind of how you squat and how your core moves. Sometimes it's an internal exam, more like going to go see, for your annual pap smear, okay? So, and they'll kind of feel around and see what's happening muscularly. They can also do really cool things, like they'll have like sensors, and they'll be like, okay, do a Kegel. And you do it, And the screen will like light up if you got enough strength or too much or whatever. So they have some tools that I don't have. Really, 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 if you take anything away from this, please go see a pelvic floor physiotherapist, okay? They're there for you. I don't know why your doctors aren't sending you, so I'm sending you instead, okay? So let's talk a little bit about what the pelvic floor is. I have two different pictures. This one's kind of more cartoonish, but you can see that it's kind of like a hammock structure. Most of us don't know. Do you guys ever think about what your pelvic floors look like? Probably not. It's like a hammock-like structure. So from your pubic bone to your tailbone, it's kind of a hammock. And what it does is it holds up the organs. It helps to keep your spine stable. It controls the sphincters. So like urine, feces, it kind of closes those things off and keeps them where they're supposed to be. Helps to manage pressure inside. We'll talk about that more in a second. And this is kind of from the bottom view. But you can see that there's kind of like, there's 17 different muscles, I think. And they kind of act independently. There's kind of a front side and a back side. And so sometimes people like the front side will be overactive and the back side will be weak. Or the back side will be weak and the front side will be overactive. Okay? So I need that pelvic floor to do a couple different jobs. So y'all know what an accordion is? I grew up in a Polish family, so I know all about accordions. But so I want that pelvic floor to kind of act like an accordion. So when you inhale, I want it to get longer. And when you exhale, I want it to get shorter. So why don't you just stand up for me real quick. So we're going to put one hand here and one hand here. And when you inhale, I want you to think about getting some length. So inhale, and then when you exhale, it gets shorter. It's hard to do, right? Inhale, and then exhale. Okay, have a seat. We're going to try that again in a second. So sometimes what I find when I screen people, come on in, is that one of those things is hard. They go to inhale, and it's just like things are really tight, and they can't get any length. And they go to exhale, and maybe like they can't, it's not strong enough, it's not contracting. So I need pelvic floor to do a couple jobs. I need it to relax completely, I need it to contract completely, and I need to do it at the right time. So completely relaxed, completely tightened, and do it at the right time. Just general, we're gonna do more practice later, I just need to give you guys an overview. So what that has to do with is balancing intra-abdominal pressure. So when you are 17 and you don't appreciate any of these things, body functions amazingly. Diaphragm, pelvic floor. You inhale, they go down. You exhale, they come up. And probably your ribs go out to the side, and then they go in. And everything kind of just like spreads out evenly. Then you have a human in the way. There's baby. So now when you breathe, those things aren't traveling like they're supposed to. So now when we take a deep breath, we go. You guys feel that? If I tell you right now to do a deep breath, go. Everybody's shoulders just went way up, okay? So what happens is there's kind of a disconnect where now the breath doesn't move the pelvic floor, okay? And if the breath doesn't move the pelvic floor, when you sneeze, you don't get any help. So what I'm trying to tell you is we can retrain this. There was a pattern when you were 17. It's just a pattern. Baby's in the way, maybe 2 babies, 3 babies, 4 babies, who knows? Baby's in the way, pattern gets off, kind of gets off track. So then when you sneeze, that pelvic floor doesn't contract. That accordion doesn't close. And so that is something that can be retrained. Does that make sense? So these women that are telling you, oh, you've had a baby, now you're just gonna pee your pants, just wear a panty liner, we all do it. If we can train your quad, or we can train your bicep, we can train this muscle to do what it's supposed to do when it's supposed to do it. Okay, so you don't have to understand all the science of it, you just need to know that if you go to pelvic floor physiotherapy, or if you spend some time with me, we might spend a lot of time breathing. It seems really bizarre, but what we're doing is resetting that pattern so your pelvic floor will behave like it's supposed to. Questions so far? Okay. So I'm going to, real quick, give you another visual. So I have diaphragm, I have pelvic floor. When you inhale, diaphragm gets longer, pelvic floor gets longer, and when you exhale, they both get shorter. I'm just gonna let you watch it for a second, and I want you to see if you can match your breathing to the breathing on the screen. So, inhale, exhale. Inhale, gets long, exhale. Inhale, exhale. kind of hard to do. So sometimes it takes me 30, 40 minutes one-on-one with somebody just to kind of retrain that pattern, but once they get it, they might be like, I sneezed and I was okay. So it's just kind of interesting. Sometimes it's just a coordination thing, like learning to ride a bike again or something, like just need to get that coordination. So what happens here? How many of you get like tight up in here, right? Sounds really familiar. Part of what that's from is you take 20,000 breaths a day. These muscles get really tight. Now let's say you're nursing a baby, or you're carrying toddlers, and everybody's way up here, right? Everything's really tight, pelvic floor is not participating, and now we have pelvic floor issues, or we have back pain, or we have hip pain. Retraining the breathing can make that much better, okay? So part of the way that I teach this, you guys can stand back up. So a lot of what people will tell you is just do Kegels. And most of us read about Kegels in like Cosmo magazine when we were like 17 or something. And they'll tell you just like do 100 Kegels a day. Every time you're at a stoplight, oh, I need to be here. Every time I'm at a stoplight, I'm supposed to do Kegels. And what that usually looks like for people is clenching their bum and kind of right into the perineum, like right at the end of the vaginal canal, just like a little clench at the very bottom. But that doesn't actually get your pelvic floor. So when I train a pelvic floor contraction or Kegel, I do it differently. So what I tell you is I want you to inhale, get that expansion, and then when you exhale, I want you to imagine you are picking up a blueberry up into your vagina. Okay? so put hands right here. Inhale, try to breathe into your hands. Exhale, pick up a blueberry. That is a pelvic floor contraction. You may or may not felt it in your body, but that's kind of how we cue it. Try it one more time. Inhale. Exhale, pick up a blueberry. Okay? Weird sensation. Does that feel different than what you thought was a Kegel? Okay? Now I want you to do something different. I want you to lean kind of forward into your toes. Almost like you're on like a ski jump. You see what I'm saying? Now try that again. Inhale. Exhale, pick up a blueberry. Do you feel more tightness that time, leaning forward? Good, have a seat. So a lot of times when people are doing Kegels, again, it's right kind of at the end of the vaginal canal, or they get kind of a butt clenching, but they're not really getting that front of the pelvic floor, which is what helps to stop the flow of urine. So if I can retrain that muscle, and I can get that front of the pelvic floor, we're gonna have a lot better control. Does that make sense? I know you can't learn it all in one day. Sorry, I walk around a lot. I know you can't learn it all in one day. I'm just trying to show you that this is what it's like to retrain that muscle to function better. The other thing I want to say is when I was racing and skating and doing all my things and having pelvic floor dysfunction, I was doing hundreds of Kegels a day because I was having some issues and thought, well, I guess I just need to do more. But that's not how it works. I need to do them correctly, and I need to do like a certain number. Uh-oh. Sorry. Oh, good. Okay. So slightly forward, I was not getting any sort of connection. I was just kind of clenching, but I wasn't really getting a pelvic floor contraction and wasn't taking that muscle through the full range of motion. Okay. So,
how many on a day should we do?
Well, I don't know. So this is why I need you to go to pelvic floor physiotherapy or come see me one-on-one. Because I don't know if your pelvic floor is weak or if it's tight. You know how we talked about somebody has to do the work? Okay, so in your body or anybody's body, perhaps your pelvic floor is trying to do too much work because your glutes aren't doing enough, your core is not doing enough. And so if your pelvic floor is already really, really tight, I don't want you to do any. We actually need it to relax. But if your pelvic floor is not doing enough work, then yes, we need to do more Kegels, and I don't know until I get my hands on you and try to figure that out. Does that make sense? And so this is what's tricky in terms of trying to repair your core off of a Pinterest article or something, is that Pinterest article doesn't know what your body is doing to try to give you extra strength and then what the right prescription is. So for some women, Kegels is a great answer done correctly. For some women, it actually makes things worse. So for me, in kind of my racing days, I was doing them and doing them and doing them. It's making everything worse because I was so tight, and then doing more and more and more. Kind of like your jaw. You know how you don't necessarily want your jaw to be really, really strong. You need it to open. You need it to close. You need it to close hard enough that you can bite. But you don't need it to be like this to where your whole jaw is aching. Does that make sense? Open, close, plenty of strength. Same thing with the pelvic floor. Long, short, plenty of strength, but not necessarily stronger, you know? So you don't know. Go see a pelvic floor physio or come see me one-on-one. Okay, so let's talk a little bit about diastasis. During pregnancy, this is an amazing function, okay? So right here, linea alba, connective tissue that connects the rectus. It opens to allow room for your amazing human to grow. This is awesome because if this didn't happen, baby may have intrauterine growth restriction and not have enough space and not be able to develop properly. So sometimes people are like, oh, how do I avoid diastasis? I'm like, you don't, it's awesome, okay? So we actually love this, that it opens and gives baby room to grow, and then hopefully after pregnancy, it comes together after a time. In about 30% of women at the end of 1 year postpartum, it has not closed yet, okay? Sometimes that's not a problem. There's a gap, my stomach looks a little different than I'd like it to, but it's not, I don't have an issue with it. I don't have back pain, I'm not having leaking, I'm fine. Other times we have diastasis and we have symptoms. So I'm actually gonna have Lauren jump up here real quick. Here, Lauren, can you?
Yeah.
So Lauren's somebody who is worked out throughout her pregnancy. Just kind of lay here, knees bent, right up here. Yeah. So she's been working on closing her diastasis, but I'm just going to show you how I screen for that in case you don't know. So the best. So I'm going to run my fingers. Well, first I'm just going to kind of look and kind of see how body is behaving, okay? Kind of how skin is moving. And I'm just going to touch and feel for tension. I care way more about tension than I do about the gap. So she has pretty good tension. Like I can't stick my fingers way down in her abdomen. So pretty good tension. What I'm gonna have her do now is I'm gonna have her tuck her chin and do kind of a slight crunch. And I'm gonna feel right at the umbilical at about 4.5 centimeters up and 4.5 centimeters down and just kind of feel for that gap. So go ahead and tuck your chin and sit up. Okay, so she did have, what were we at?
2 or 3.
2 or 3 fingers, and we're pretty much closed there. Still a little gap at the umbilicus, and about 1.5, about 4.5 centimeters below. And tuck your chin, or lay down. I'm gonna have her do one more thing. I'm gonna have her inhale, and we've been working together, so she knows how to do this, but I'm gonna have her inhale, and then on the exhale, pick up the blueberry, and I'm gonna see how that tension changes. So sit up, exhale, there. So her gap actually closed. When she exhaled and got that pelvic floor contraction, the gap closed. Go ahead. So in my book, you're good. Go ahead and roll up. So it doesn't matter that it's not all the way closed. What matters is that she has connection. What happens is if we have a wide gap and we don't have connection, we don't have protection, then something else has to do the work. If diastasis is still wide, we don't have connection, you step off a curb, you feel a little off, something has to do the work, hips, back, you know, and now we have all this tension around here, or sometimes we have more leaking, those kinds of things. So diastasis is not always a problem. It's a problem for you if you're not getting the support you need, okay? And then you're getting that support elsewhere and body's just kind of feeling aching and not so good. Questions about diastasis before I go on? Yes.
When you're pregnant, I mean, I've read about not doing exercises that increase your intra-abdominal pressure.
Yes.
Is that right? You should avoid that kind of stuff?
Correct. So in some ways you're going to have, I mean, when you breathe, your intra-abdominal pressure increases. But yes, there are things that you can do. If you are overhead pressing and your ribs and hips are kind of arched, and then you inhale, that could increase the diastasis. So yes, we want to train your body to be here, and we want to train your breath to kind of travel all the way around. I sent Sarah to go get a ball and she couldn't find one. Sometimes when I talk, I bring a balloon, and I just picture like that balloon squeezing. And so if there's picture like a balloon inside of a canister. Can you picture that? And I squeeze. If there's an opening at the top or in the front, it's kind of going to push out there, right? But if I can blow up the balloon and it spreads out evenly, we're going to have a better situation than if it goes out one way. Does that make sense? So yes, during pregnancy, everyone will get diastasis, 99.9% of people. So there's sometimes you'll see stuff on Instagram about like avoid diastasis. It's like, it's helping your baby grow, it might be helping you feel better, and everyone's gonna get it, that's okay. But we do want to, when you're under load, kind of keep a rib over hip position and be breathing all the way around and making sure pelvic floor is moving. So, I don't want to go too into detail, but if pelvic floor is like really tight and not moving, and you inhale, your organs don't have anywhere to go, so they press forward. Does that make sense? Where if when you inhale, pelvic floor gives space, they're not going to press out through the front of the diastasis. Does that make sense? So you can't avoid it completely, but what you can do is breathe in a certain way on purpose and not arch your back to where you're pressing everything kind of forward. Does that make sense? Okay. So I'm going a little too slow. So one thing I want you to know is that diastasis can protect you and it can protect your baby. The next thing we're going to talk about is pelvic organ prolapse, where organs kind of descend into, I know. So the organs can kind of descend, but we talked about that pressure. If the pressure can go forward or it can go down, the pressure going forward is easier to deal with than pressure going down. So sometimes I see people kind of overly aggressive, trying to like close the diastasis at all costs, and then that pressure goes somewhere else, it goes down. So just know that your diastasis could be helping you, and we want to be really thoughtful about how we proceed with that, okay? So, so again, be careful with like YouTubers who claim they can close the gap. They might be able to, at what cost? Like if things aren't distributed the right way, you know? Just be aware that there's a lot of people out there who are not qualified to give health advice. So just be wary, okay? So, all right, so let's talk a little bit about pelvic organ prolapse. I also have a small prolapse. Mine is asymptomatic. I didn't even know I had it until I went to pelvic floor physiotherapy, but I do have one. So 50% of women, 50% of women have some degree of prolapse after pregnancy. That's a lot. So these women that I meet with are like, I have this thing. Like they think this like weird thing that never happened to everybody else happened to them. This is very, very, very common, okay? So essentially, the pelvic organs from their original position are sitting a little lower, okay? Sometimes they sit low enough that they kind of descend through the vaginal canal, okay? A lot of people don't even know they have this. They don't even know that their symptoms are connected, and this is why it's great to go to pelvic floor physio. I can't actually screen for this. But not everyone who has a pelvic organ prolapse is symptomatic, okay? So it just depends on you. I've had people who are grade 1 who have symptoms, and people who are grade 3 who don't have symptoms. It just kind of depends on your body and physiology. But same thing, we still need to retrain how the pelvic floor behaves when you breathe. So you inhale, it gets longer. You exhale, it contracts. And what that does is it helps to lift those organs back where they need to be. A lot of times women are given the advice, well, you just need to have surgery. And surgery can be an excellent option for certain people, okay? So sometimes people have surgery, that's the end of that. It's over, okay? Sometimes people have surgery and they continue to have symptoms because even though we've lifted up the organs, we still have that pressure and we still have that muscle that's not getting long and short like we'd like it to. So I am not anti-surgery, but I still want to retrain those muscles for better control. So if I get a bladder sling put in, okay, because my bladder is descending, but my pelvic floor is still not moving, my glutes are still weak, so my pelvic floor is really tight, it's trying to take over, those symptoms are going to kind of just shift. And so I just always recommend a tandem approach that you may need surgery and that's between you and your provider, great. But I also try to figure out like, how did we end up here in the first place? And if we don't address those things, what else might pop up? Sometimes I see people who like get pelvic organ prolapse surgery and then later they develop a diastasis because there was all that pressure and now it's up and there's nowhere for it to go, you know? Or so I just like to work on the muscles around the pelvic floor and work on the pelvic floor itself even if there is a surgical intervention. So this is just a friendlier picture of pelvic organ prolapse, but essentially we have that hammock, that pelvic floor hammock, and then some of the organs kind of push down. Does that make sense? So how would you know? You may be asymptomatic. It might feel kind of heavy. I have a lot of women tell me it feels like maybe they have a tampon stuck in their vaginal canal, or it feels kind of just like awkward, like you need to, it just feels heavy at the end of the day. You want to like lift everything up. Sometimes there's pain during sex. Sometimes it feels like not being able to completely empty your bladder or void your bowels, like it feels incomplete. Sometimes they have pelvic or back pain. So if we're not getting support here, this may take over and back pain happens a lot. I mean, you might have back pain because you tore a disc when you were skiing, who knows? But sometimes women have back pain because they're just not getting the support they need here. There's a misnomer. A lot of people think, like, I had a C-section, I can't have prolapse. That's not true. So that 9 months when baby's sitting on pelvic floor changes how it functions. There can still be symptoms even if you had a surgical delivery or a C-section. So that can still happen. One thing I want to make a note of, pessaries. Anybody ever heard of a pessary? Okay. So often these are only given to menopausal women, which does not make any sense to me. So I recommend if you go see a pelvic floor physio, ask, am I a candidate for a pessary? There's tons of different kinds. There's ring pessaries, there's cube pessaries, there's different kinds of things. Some of them look almost like a little like Tupperware lid or like a, just a little different shaped plastic thing that you can insert into your vaginal canal that if your bladder is kind of like collapsing into the vagina, it just offers some pressure to keep that organ where it's supposed to be. So I have had some women who were not offered a pessary. I said, go ask if you're a candidate. They try 1 or 2 different ones and they're like, for now my symptoms are good. So then we have time to kind of strengthen things before they look at a surgery option. So just know that that's out there. Why it's not recommended, I could not figure it out. But I have found clients that it's been really, really helpful for to use a pessary. So incontinence, so there's a couple different things. I had stress incontinence, meaning the stress of what I was doing was too much for my bladder. So if I jumped, the stress of the jumping was too much and my bladder lost control. That's stress incontinence. Sometimes a sneeze is stress incontinence. The stress and compression of the sneeze is too much, okay? That's stress incontinence. Urge incontinence is when like you're putting the key in the door and you're almost home to the bathroom, but you can't quite make it. Stress incontinence, urge incontinence, or most women have mixed incontinence. They have a little bit of both. All of those things can be addressed. So it just depends. Often it looks like pelvic floor tension. Often it's that kind of like lean forward and getting that front of the pelvic floor contraction that really helps with that. But don't do a million Kegels. So like I said, I had hypertonic pelvic floor. My pelvic floor was like this, like the rest of me, just like, ah. And so the more Kegels I did, the worse my incontinence got. So it might be that you need help relaxing your pelvic floor and not necessarily strengthening your pelvic floor. Okay, so there's just a lot of confusion about that. So all this stuff can be worked on. That muscle can be trained just like your bicep. So sometimes we also do a little bit of like adult potty training. Like sometimes caffeine is a bladder irritant. Sometimes I have a lot of women drinking a ton of LaCroix, and that can be a bladder irritant. And sometimes there's a lot of preemptive peeing, like I'm gonna do this class later, so even though I don't have to pee, I'm gonna try and pee. And then that kind of reflex that tells you when you're full and time to empty, that kind of gets off, and we have to do a little bit of retraining there. So when I have somebody have a baby, very early, like I would never have somebody have a baby and just like jump into a boot camp. We start with just breathing, really soft, really light. We start with like posture, getting things back in alignment, and then we gradually add up. After I had my babies, I got my 6-week checkup and I went and ran 5 miles. Not fast, but I did not do this knowing what I know now. I would do it very, very differently. And I really try and create a safe space for women to just take time and let things kind of build from the core out, and I feel a ton better. So just kind of adding up. And so again, don't be afraid to talk about it. So, questions?